Most people think a heart attack feels like someone grabbing the center of your chest and squeezing. But what if the first warning sign does not feel like chest pain at all? What if it feels like indigestion after dinner, a strange wave of fatigue, pain in your jaw, or suddenly being short of breath while doing something you normally handle easily? That is where many people, especially after 50, get into danger. Not because they ignore their heart on purpose, but because the heart does not always speak in the language we expect. I'm Dr. Ryan Mitchell, and today I want to walk you through 6 heart attack warning signs that may not feel like chest pain. And the last one may be the most dangerous, not because it is dramatic, but because it is so easy to explain away as aging, stress, poor sleep, or simply having a slow day. Before we begin, this is important. If you think you or someone near you may be having a heart attack, do not wait to see if it passes. Call emergency services immediately. Food, rest, home remedies, deep breathing, or waiting for morning are not the right response to a possible heart attack. Because when a heart attack begins, time is heart muscle. A heart attack usually happens when blood flow through one of the coronary arteries becomes blocked. These are the arteries that feed the heart muscle itself. If oxygen-rich blood cannot reach part of the heart, that muscle begins to suffer. Think of the heart like an engine that never gets a break. It beats day and night, and it depends on a steady fuel line of oxygen. When that fuel line is blocked, the engine does not simply complain. It starts to become injured. And here's the part most people miss. The body may send distress signals through the chest, yes, but it may also send them through the lungs, the stomach, the jaw, the back, the nervous system, or the whole body. So let's begin with the first warning sign that does not always feel like chest pain. The first sign is shortness of breath without a clear reason. This can be subtle. You walk across the room and suddenly feel winded. You climb a few stairs and need to stop. You sit in a chair and feel like you cannot quite get a satisfying breath. Many people over 50 tell themselves, "I'm just out of shape," or "Maybe I gained a few pounds," or "I'm just tired today." And sometimes, yes, shortness of breath can come from lung problems, anemia, anxiety, infection, poor conditioning, or many other causes. But during a heart attack, shortness of breath can happen because the heart is struggling to pump effectively while the heart muscle itself is being deprived of oxygen. The heart and lungs work as a team. The lungs bring oxygen in. The heart moves that oxygen through the bloodstream. When the heart is under attack, the entire oxygen delivery system can feel unstable. Your body may respond by making you breathe faster or deeper, even when the real problem is not the air coming in, but the blood flow moving through the heart. That is why unexplained breathlessness matters, especially if it comes on suddenly, especially if it happens during light activity that normally does not bother you, and especially if it appears with sweating, nausea, dizziness, weakness, or discomfort in the jaw, arm, shoulder, back, or stomach. But that's only part of the story, because the second warning sign is one of the most confusing. Pain somewhere else, not the chest, the jaw, the neck, the shoulder, the arm, the upper back, even the upper stomach. This is where people get fooled. A man may feel aching down his left arm and think he slept wrong. A woman may feel discomfort between her shoulder blades and blame posture. Someone else may feel jaw pain and assume it is dental. Another person may feel pressure high in the stomach and think it is gas. But the heart has nerve pathways that overlap with other parts of the upper body. The brain is not always perfect at locating the source of internal pain. When the heart is in trouble, the emergency signal can travel along shared wiring, and the brain may interpret that signal as pain in a place that seems unrelated. This is called referred pain. Plainly said, the heart may be the source, but the brain may point to another address. That is why heart-related pain may show up in the jaw, neck, shoulder, back, arm, or upper belly. It may feel like pressure. It may feel like aching. It may come and go. It may not be sharp. It may not even be severe. And this is where older adults need to be especially careful. After 50 or 60, many people already have aches and pains, arthritis, neck stiffness, shoulder problems, back tension, acid reflux, dental issues. So when a new symptom appears, the mind reaches for the most familiar explanation. But the more important question is not, can I explain this symptom? The better question is this symptom new, unusual, unexplained, or happening together with other warning signs? Jaw pain plus sweating, back discomfort plus nausea, arm aching plus shortness of breath, upper stomach pressure plus sudden weakness. That combination changes the meaning. Because a heart attack is often not one isolated symptom, it is a pattern, and the pattern is what saves lives. Now, the third warning sign may be the one people dismiss after a meal: nausea, heartburn, vomiting, or indigestion. This one is dangerous because it feels so ordinary. You eat dinner, you feel pressure, you feel queasy, you burp, you feel burning, you think, it must be reflux, or it was the spicy food, or maybe I ate too fast. And sometimes that is exactly what it is. But heart attacks can produce digestive type symptoms. The heart and digestive organs communicate with the brain through parts of the nervous system that are closely connected. When the heart is under stress, the body's alarm system can create nausea, stomach upset, or a sensation that feels like indigestion. This is especially important because stomach-like symptoms may not create the same fear as chest pain. Chest pain makes people pause. Indigestion makes people reach for antacids, and that delay can be costly. Here is the practical way to think about it. Ordinary heartburn usually has a pattern you recognize. Maybe it happens after a certain food. Maybe it improves with your usual medication. Maybe it feels the same as it has felt for years. But a possible heart warning sign may feel different. It may come with shortness of breath. It may come with cold sweat. It may come with jaw, back, shoulder, or arm discomfort. It may happen during activity. It may feel like pressure or heaviness high in the stomach, rather than a typical burning sensation. And for some people, especially women, older adults, and people with diabetes, symptoms may be less classic. Diabetes can affect nerves, which may blunt or change pain signals. Older adults may also have more subtle symptoms, or may attribute serious symptoms to common daily problems. So do not judge the seriousness of a symptom by whether it feels dramatic. A quiet warning can still be a real warning. And that brings us to the fourth sign: a sudden cold sweat. Not sweating because the room is hot, not sweating because you just exercised. A cold, clammy, strange sweat that seems to come out of nowhere. This is your body's emergency alarm. When the heart is under threat, the nervous system may activate what many people call the fight or flight response. This is the survival system that releases stress signals when the body senses danger. Your pulse may change. Your skin may feel cool or clammy. You may sweat even though you are not overheated. Think of it like an internal alarm bell. The heart is struggling, and the body starts shifting resources toward survival. Blood flow may be redirected. Stress hormones rise. The skin can become sweaty, pale, or clammy. And many people describe something else with it: a feeling that something is not right, a wave of uneasiness, a sense of doom. Now, by itself, sweating can happen for many reasons. Low blood sugar, menopause-related hot flashes, infection, anxiety, medication effects, and heat can all cause sweating. But a cold sweat that arrives suddenly and feels unusual, especially with nausea, breathlessness, dizziness, weakness, or upper body discomfort, should not be brushed off. This is where I want you to remember a simple rule. When the body creates a sudden alarm and you cannot explain it, listen to it. Do not negotiate with it. Do not wait an hour to see if it becomes more obvious. A heart attack does not have to become unbearable before it becomes dangerous. Now, the fifth warning sign is lightheadedness, weakness, faintness, or sudden dizziness. This can feel vague, and vague symptoms are often the ones people delay on. A person may say, "I just feel off. I feel weak. I feel like I might pass out. My legs feel strange. I need to sit down." This matters because the brain depends on steady blood flow every second. If the heart is not pumping normally, or if the body is under sudden cardiovascular stress, the brain may receive an unstable supply of oxygen-rich blood. That can create dizziness, faintness, confusion, weakness, or the feeling that you may collapse. Again, this does not mean every dizzy spell is a heart attack. Dizziness can come from dehydration, inner ear problems, blood pressure changes, medications, low blood sugar, and many other causes. But when dizziness appears suddenly with other warning signs, it becomes much more concerning. Dizziness plus cold sweat, weakness plus nausea, faintness plus shortness of breath, lightheadedness plus jaw, back, arm, or upper stomach discomfort. That is not something to sleep off. And after 50, this becomes even more important because many people take blood pressure medications, diabetes medications, heart medications, or blood thinners. Symptoms can overlap. The body's warning signs can be quieter, and people may convince themselves that they are just tired, dehydrated, or having a medication side effect. But here's the truth. You do not need to diagnose yourself before calling for help. That is not your job. Your job is to recognize a possible emergency and act quickly. Emergency professionals would much rather evaluate you and find out it was not a heart attack than have you stay home during the early window when treatment can protect heart muscle. And now we come to the sixth sign, the one that may be the easiest to ignore: unusual fatigue. Not ordinary tiredness after a long day, not feeling sleepy because you stayed up late. I'm talking about fatigue that feels different, a sudden heaviness, a strange weakness, a drained feeling that does not match what you did, a sense that basic tasks require more effort than they should. For some people, this can appear hours or even days before a heart attack becomes obvious. They may say, "I just haven't felt like myself," or "I could barely do the laundry," or "walking to the bathroom wore me out," or "I thought I was coming down with something." And this is why fatigue is so dangerous, because fatigue has 1,000 excuses: age, poor sleep, stress, grief, caregiving, retirement changes, medications, low mood, busy schedules, not enough exercise, too much exercise. The mind can explain fatigue very easily, but the heart may be telling a deeper story. When the heart muscle is not getting enough oxygen, the body may begin to conserve energy. Imagine a city facing a power shortage. The system starts dimming lights in less essential areas to protect the core. In the body, that can feel like weakness, exhaustion, or a sudden inability to do what you normally do. For adults over 50, this matters because daily function is one of the best clues you have. Can you do your normal walk? Can you climb your usual stairs? Can you cook, shower, dress, or carry groceries the way you normally do? If your capacity suddenly changes, do not automatically call it aging. Aging is usually gradual. A warning sign is often different, new, or out of proportion. And fatigue becomes even more concerning when it appears with breathlessness, nausea, sweating, dizziness, or discomfort in the jaw, back, shoulder, arm, neck, or upper stomach. That combination deserves immediate attention. Now let's connect all 6 signs so you can remember them clearly. A heart attack may show up as shortness of breath. It may show up as pain or discomfort in the jaw, neck, back, shoulder, arm, or stomach. It may feel like nausea, vomiting, heartburn, or indigestion. It may trigger a cold sweat. It may create lightheadedness, weakness, faintness, or sudden dizziness. And it may appear as unusual fatigue that feels different from your normal tiredness. The key is not to panic over every small sensation. The key is to respect symptoms that are new, unexplained, unusual, sudden, or clustered together. Because heart attack symptoms are not always loud. Sometimes they whisper. And if you are over 50, or you have high blood pressure, diabetes, high cholesterol, smoking history, kidney disease, obesity, a family history of heart disease, or previous heart problems, you need to take those whispers seriously. So what should you do if these warning signs appear? Call emergency services immediately. Do not drive yourself unless there is absolutely no other option. If your heart rhythm becomes unstable or you become faint, driving can put you and others in danger. Do not wait for the symptom to become chest pain. Do not take a shower to see if it helps. Do not go lie down alone in another room. And be careful with aspirin. Some people are told to take aspirin during a suspected heart attack, but it is not right for everyone. Allergies, bleeding risk, stomach ulcers, blood thinners, and other medical issues matter. Follow the advice of the emergency operator or your clinician. The most important treatment is rapid medical care. Because the earlier blood flow is restored, the better the chance of limiting heart muscle damage. So here's the message I want you to carry with you. A heart attack does not always look like the movie version. It may look like a person sitting quietly at the kitchen table, sweating and nauseated. It may look like someone rubbing their jaw and saying they feel strange. It may look like a woman who suddenly cannot finish her normal walk. It may look like an older man who thinks he has indigestion, but also feels short of breath. It may look like fatigue that simply does not make sense. And that is why knowing these signs matters. Not to make you afraid of your body, but to help you trust your body when it is trying to warn you. I'm Dr. Ryan Mitchell. If one of these warning signs surprised you, write it in the comments. Share this video with someone over 50, because this is the kind of information people often need before they know they need it. And subscribe for more science-backed health guidance that helps you recognize important changes early, protect your heart, and make smarter decisions for your health.